I'm Tom Kane. I guess I'm the treasurer of the section currently, mental health section. Today's presentation by Hanna Burkly is part of our Mental Health Awareness Month program. And the section is running a number of events throughout the month. And we started last week and we'll go obviously through the end of the month. Mental health awareness. Mental health is often associated with mental illness, but we know better that mental health can be and should be associated with mental health wellness, which includes issues like prevention of illness and promotion of wellness. And I think Hannah's presentation today fits into that category, which is based upon a case study that she published last year in the Journal of Urban Design and Mental Health. The title of that study was Washington, D.C., USA, an Urban Design and Mental Health Case Study. Yay, Washington, D.C. I think Hannah's bio was associated with the announcement, and so I won't go into more detail with that. But with that, we'll give the screen to Hanna, let her proceed. I think we'll take questions to the extent anyone has questions at the end. We have an hour and we may or may not use the whole hour, but it's up to Hanna and it's up to you all as you want to pitch in. So Hanna, thank you for participating. Thank you for doing this. And thank you for sharing your research, and take it away.
All right, thank you so much, Tom. I'm really happy to be here. Just for a little bit background, Tom reached out to me and asked me to present my paper, and this paper was written, I think, 2 years ago. And at the time, I had been working towards my master's degree in global health at Georgetown University. This was like a capstone project, so I'm aware that I'm in the presence of some PhDs, some professors, some folks who are coming at this from lots of different angles. And I'm very grateful for the opportunity to present what I had found, because I think that at the forefront of, I guess, the main reason for my wanting to talk about this and accepting this opportunity is that I think that there isn't enough research in this field, and I think that there's so much that needs to be done. So I'm really enthusiastic seeing the responses in the chat and kind of getting a better sense of who's in this group right now and what you all might bring to this mental health conversation. So with that, I'll go ahead and present. Let me see if I can share my screen. All right, perfect. So this is going to be super informal. I'm just going to be touching on some of the key findings from the capstone projects that I had done at Georgetown. And at any point, if you have questions or comments, feel free to write them in the chat, and then we'll be able to open this up into a conversation toward the second half. So a little background on the journal. So this is the Journal of Urban Design and Mental Health, and it has a very specific layout. So basically, the journal is looking at urban design and mental health in different cities around the world and within the United States, trying to look at pro-mental health design. So they have a framework which basically looks at, it's called GAPS, and GAPS standing for green spaces, active spaces, pro-social spaces, and safe spaces. And so when I submitted my idea to my professors and for the journal, I was doing so within this framework, within the GAPS framework. So anyways, I was doing a city case study on Washington, D.C., looking at urban design and mental health and how those two things might interrelate within our city. As far as the methods, so again, the GAPS framework, so green, active, pro-social, and safe spaces. And the idea was that these types of places have been demonstrated to be beneficial mental health. But one issue that I ran into pretty early with writing this paper was just the fact that mental health itself is a very broad concept. And it's very difficult to prove any sort of causality, especially with the limited resources and funding that mental health and specifically urban spaces have had in the past. So I was looking mostly at overlaying kind of different maps of DC, looking at what do the green spaces in the city look like, what do the pro-social and active spaces in the city look like, and then overlaying that with some mental health statistics, oftentimes having to use proxies in order to just get a sense of if there was any sort of correlation within our city. So in addition to doing that, I was also speaking to folks within DC that had some say over policies such as transportation, disability, so like disability positive design, and just urban planners in general who were involved with projects in DC. So that was really more just to get, from my perspective, just a more holistic view of how the decisions are made to implement different specific mental health friendly design within the district. I'm going to skip over the history of urban planning. I think it's interesting stuff, but I want to get to the meat of the paper. So for those of you who are in DC or have been to DC and have lived here, we all know this map. So basically DC is broken up into 8 wards, and historically the Anacostia River has been a divider of socioeconomic status. A lot of the resources have often gone toward one end of the river and not, or one side of the river and not the other. And so anyways, so these are the 8 wards. And then of course, as DC started to develop, right, there was a lot of beautification and development work that was done for the heart of the city, where there was the most, I guess, development. And so now we have, the National Mall and a lot of other beautiful areas in DC. But in terms of Ward 7 and 8, again, on the other side of the Anacostia River to the east, there was definitely a lack of that same attention to detail in, beautifying the city. In the paper, I go into just the demographic shifts that have occurred, specifically Shaw, Bloomingdale, and Navy Yard, all having kind of experienced a population shift, more working age adults, new infrastructure, job creation, economic growth. And then of course that leading to gentrification as well, and a higher cost of living. So I then went into just like the leadership for health. So discussing Mayor Muriel Bowser and some of her efforts for her sustainable DC plan. So within the sustainable DC plan, they talk about jobs and economy, health and wellness, equity and diversity, and climate and the environment. And so I reference that sustainable DC plan throughout the paper, just as kind of a touchstone for how different changes were related to that broader goal. So now to the interesting part, and the part that is the most related to the topic of today. So mental health in Washington, DC. I'm sure most of you are familiar with disability adjusted life years, or DALYs. So basically, this chart, which was taken from, oh gosh, I wrote this it feels like so long ago. It was only 2 years ago. Okay. Let me see. Okay. Yeah, so it's the University of Washington. Okay. So basically I was comparing 1990 versus 2016. What was the kind of, how were the disability adjusted life years ranked? And as we can see in 1990, the majority of the DALYs had to do with more physical diseases, cardiovascular, neoplasms, HIV, AIDS, and tuberculosis. but mental disorders was still, at number 4. Since then, communicable diseases have gone way down, as we know. Injuries have gone down a bit, but then the non-communicable diseases have really taken up the majority of our tallies. And most notably for this paper, mental disorders, which again is very broadly, it's a broad category, but it climbed to second place just after cardiovascular diseases. And this is within the District of Columbia itself, but it was also mirrored kind of throughout the country. And then important to note, so Mental Health America created the State of Mental Health, which was a document that looked at the 50 states plus the District of Columbia and looked at the prevalence of mental illness in different categories. So adults with any mental illness, adults with dependence or abuse of illicit drugs or alcohol, serious thoughts of suicide, and then youth with at least one past major depressive disorder, dependence on drugs or alcohol, and youth with severe depression. So it was one of the only ones that I was actually able to find that broke down the prevalence of mental illness in the United States by state. That being said, I think that even within looking through the document and getting a better sense of what these definitions are and how they were using them, it was clear that it's very hard to account for folks who just don't go undiagnosed, right? And as I'll touch later on this paper, there's also a relationship between access and wealth and education and seeking out mental health services and actually getting your diagnosis versus going undiagnosed. So anyways, probably the most important definition that we should go over is the idea of adults with any mental illness. So that was anyone who has a diagnosable mental, behavioral, or emotional disorder other than developmental or substance use. Okay. So basically, another kind of key thing to note is, so DC's ranking was compared to other states, not other cities. So oftentimes where cities are more concentrated, when there's more people, there tend to be worse outcomes in terms of mental health, substance use, etc. But the district ranked 30th in terms of adults with any mental illness. And the estimate when that State of Mental Health document came out was that about 19% of the population had any mental illness. Again, unclear, kind of exactly what percent that actually represents, right, of the total. But that was as close of an estimate as I was able to find. With youth, it was lower. DC actually had the lowest prevalence at only 8.69% as compared to the national average of 11%, which was surprising to me and also made me want to explore that further. Why, if those numbers are indeed correct, what is it about DC that has youth with lower mental health prevalence issues? So as compared to the national averages, according to this paper that I'm referencing, DC ranked the worst in terms of dependence of or abuse of illicit drugs or alcohol in both adults and youth. It had a high proportion of its population of adults with any mental illness, but that among young people, it was unclear, why that was a lower percentage. Again, it's important to note mental illness is really hard to track. It's hard to measure. And on top of that, different organizations, different researchers, everyone's going to use their own definition and define it in a different way. So then I looked at specific mental illness, depression being one of them. I was looking at the Behavioral Risk Factor Surveillance System, or BRFIS, which is a nationwide survey that looks at depression I believe it was self-diagnosed depression by ward. So they found that 18% of DC residents had been diagnosed at some point in their lives with depression. Again, though, the key word being diagnosed. So this is where I think it got the most interesting, and this is where my research started to really narrow in on just looking ward by ward, right? So unsurprisingly, when broken down by ward, there's disparities. So 15.9 to 16.2% of residents in wards 1 and 4 were diagnosed with a depressive disorder, while 22 to 25% of residents in ward 8 reported having been diagnosed. So if we remember, right, wards 1 and 4 are the kind of wealthier center of DC wards, and then we have ward 7 and 8. And I thought that was interesting because this was only the percentage of diagnosed cases, right? Considering the fact that ward 8 is majority people of color, majority, let's see, where was it? Lost. Okay. Yeah, so Ward 8 has the lowest access to primary care physicians who could even make that diagnosis. And statistically, according to this survey, white residents were slightly more likely to have been diagnosed with depressive disorder than Black residents. But Ward 8, which is 93% Black, still had the highest rates of adults who were diagnosed with depressive disorder. So that made me start to question, why is that? Obviously, there's lots of factors that go into someone getting a depression diagnosis. But then they also, so in addition to just looking at the diagnosis, I wanted to see what about just undiagnosed, right? What are these surveys missing? So I found Mental Health America had conducted a screening of depression in 2017 using phone interviews. And so in addition to being asked if they had been diagnosed with a depressive disorder, they were also given the patient health questionnaire, the depression screen. And 70% of respondents who had moderately severe and severe depression, according to the screen, reported never having been diagnosed by a medical professional. And so to me, this is a startling discrepancy, and it almost invalidates, it doesn't invalidate, but it points to the need for some better measure of understanding what our mental health landscape looks like in our city and in the country as a whole. Because of that discrepancy, I thought that it would be useful to also look at some proxies, right? So homelessness, although it is not, you can't know the number of people with mental health based on the number of people experiencing homelessness. There are some tie-ins, right? They can serve as a proxy, especially for severe mental illness, simply due to the fact that it can be difficult to hold down a job, to hold down a stable life if you are experiencing severe mental illness. I found some estimates that between 30 and 50% of people experiencing homelessness had a severe mental illness. And then, of course, substance use comorbidities are fairly high among the homeless population. Although, again, with the causality, right, it's difficult to know if, what's causing what, right? Of course, homelessness exacerbates mental illness, so then people are left feeling powerless, and that can become a vicious cycle that keeps them from getting treatment. So back to Mayor Bowser. So she had plans to close down DC General. This was in the news several years back. So to replace it with smaller shelters in each ward. However, they shut down DC General and then they did not open the new shelters in time. So that actually ended up with having a lot of folks who were at DC General then just on the streets. And then I looked at homelessness just in terms of how it is distributed across DC. Unemployment, which is a risk factor for becoming homeless, is 17% in Ward 8, 19% in Ward 7, and 4% in Ward 2, and 3% in Ward 3. So here we just have an unemployment by ward map. Again, showing kind of the bottom half being higher in unemployment, especially east of the Anacostia River. I also looked at poverty by ward. So this is percent poverty. Again, if you were to overlay these, there's a lot of overlap there, with Ward 8 having by far the most folks experiencing poverty. So then I move into GAPS. So GAPS, again, standing for green spaces, active spaces, pro-social spaces, and safe spaces. Now I had a little bit of a problem with the framework as a whole, just because it wasn't clear to me how those 4 spaces were chosen. It seems intuitive that green, active, and pro-social and safe spaces contribute to mental health, but I think that there also just needs to be a lot more research looking at, you know, are those the only ones? Are there other types of spaces that also contribute positively to mental health? But that's what I was given and that's what I had, so I went off of that. In terms of green spaces, we looked at local and national parks. So DC actually ranks #1 in terms of cities that have the highest percentage of parkland. So if we look at Rock Creek Park, and in addition to all of just the green space that's around DC, it's a very green city. And we have about 21% of the city being parkland. The second highest ranking was New York City, of course, because they have Grand Central, the park. And then I looked at local parks as well. So the local parks are handicap accessible and regularly maintained. And so here's kind of a map of the parks, again, noticing that, you know, especially Ward 8 there's not the same density of green spaces. So not all residents of Ward 8 live within walking distance of a local park, right? So the positive mental health outcomes of spending time in a park, which have been shown, and there is research on that, they are not able to enjoy those same mental health outcomes. And then national parks. So this is a little bit harder to kind of see, but it looks like there's the Anacostia Park here, the National Mall, which is considered, I guess, a national park, and then Rock Creek Park, which kind of spans a lot of north of DC. I discuss some contemporary efforts to expand green space, which if you're interested in specifically for DC, you can read about. Okay, active spaces. So going back to the Sustainable DC plan, the first goal was to inspire healthy, active lifestyles for all residents, regardless of income, ability, or employment. So I was looking at, okay, how walkable is and bikeable is DC, right? And where is it the most walkable and bikeable? So there's a website called WalkScore that people will use to just determine, you know, what parts of the city are the most walkable. And the scores, you know, range from, I guess here, 25 to 100. But again, noticing that, you know, if you live in wards 1, 2, 6, 4, everything's walkable. You can, you know, walk to your local grocery shop, you can walk to get your hair cut, you can walk to the restaurant down the street. And that's desirable, right? I mean, thinking about like Columbia Heights, for example, how much it's gentrified in the past 10 years, largely because it is so accessible, it's so walkable. And then here we have transit time. So this shows how far someone can travel in 30 minutes from one area to the next. So again, noticing that if you're kind of on the outskirts, you can't get very far on, or rather it would take you a very long time to get somewhere using public transit. And then for bikeability, DC scored 67 out of 100. So it has a lot of bike lanes and trails that lead out of the city. But looking at their walk, transit, and bike scores, it really differs significantly. So I'm feeling like I'm beginning to sound like a broken record, but again, there's some trends that have to do with Ward 7 and 8 basically being left out of a lot of this development that allowed folks to have that walkability. I don't go very deep into the relationship between walkable neighborhoods and mental health in this paper, although I do talk about it some. But there's a lot of very interesting research coming out now that looks at the effect that being able to, for example, walk to work can have on your mental health. The effect of being able to walk to a grocery store and have a relationship with a person who is, selling you your fruits and vegetables, selling you your bread, having a farmer's market. All of these things we know intuitively are good for mental health, right? You walk to the market, you feel good, you've gotten your sunshine, but there's finally starting to actually be research that puts some numbers to that. So if that's something that you are interested in, I highly encourage that you look into that and read some of those for yourself. But anyways, back to the walk, transit, and bike scores. So DuPont Circle, U Street, Logan Circle, Mount Vernon, and then the lowest scores for walkability, bikeability, and transit were Potomac Yard, Deanwood, River Terrace, Hillcrest, and Randall Heights. So the top 5 neighborhoods for walkability, transit, and bikeability, they were all in either wards 1, 3, and 2, and 6. Among the bottom 5s, all but the Potomac Yard neighborhood are in Ward 7. And then Potomac Yard isn't even part of DC, it's actually part of Alexandria. So basically all of the bottom ones were in Ward 7. And Sustainability DC recognized this, and so they had created several transportation targets, including increasing the use of public transit, increasing biking and walking, and reducing trips made by car and taxi. But I don't know if it met those targets or not. That would actually be interesting to look back on it now and see, now that several years have gone by. So pro-social spaces is the next piece. And I'm sure now with COVID, there's going to be more research, I think, into what do pro-social spaces look like and how do they impact mental health. So I use the definition that these are places within the built environment where people can gather and interact. And I was focusing on just the areas that are under the control of the city government, because of course, something like a restaurant with a patio is a pro-social space, but it's nearly impossible to actually, place those on a map and look at it in that way. So let's see. Okay. So there was some literature on pro-social spaces in DC. And most of the references that were made in the publication by the Office of the Mayor were talking about how pro-social spaces can strengthen civic identity, design successful neighborhoods, improve the public health realm, address infrastructure, and provide design excellence. And then I looked at some programs that were targeted at underserved neighborhoods in DC. There's the Healthy Corner Store program, which is really cool. It partners with local neighborhood shops to increase the affordability and availability of fresh produce. One thing that I came up against and struggled with this paper was just realizing how broad this subject matter is. And really, if nothing else, the main takeaway was that, there's so many areas of research where I wanted to dive deeper and I wanted to learn more. And I just came up against the wall. Nobody had done the research yet in depth about what the effects of all of these different themes that I was looking at actually are on people's mental health. But anyways, let's move on. So let's see. There's the Anacostia Waterfront Initiative, which was trying to give people more access to pro-social spaces by creating parks, pedestrian crossings, and better transportation infrastructure along the Anacostia River. Okay, in Sustainability DC, one of the targets for built environment is to provide a variety of amenities and services within a 20-minute walk of all residents. So that was the target. So it was interesting to see that they recognized the importance of that, and we're actively working to make that more equitable within the city. There's Live Near Your Work grants, which is another pro-social placemaking initiative. I looked at restaurants and retail shops as hubs of social activity, and was also looking at restaurant choices. So the fact that living in a food desert is linked to lower levels of social capital and perceived control. and that these factors can directly link to poor mental health. So a lot of these was proxies of a proxy, right? To try to figure out if there's a relationship. Here is a heat map of the concentration of restaurant choices. This shouldn't be surprising to anybody. I mean, obviously, this is where all of the money is. This is where people are working and commuting, and there's a lot of demand for restaurants. But it matters, right? It matters in terms of your sense of perceived control and your sense of being able to engage socially with other people. And then finally, we come to safe spaces. So sustainable, where's that? Okay. So I was looking at not only actual safety, but also the perception of safety, because when it comes to mental health, arguably it's more relevant how safe someone perceives themselves to be, because that's what will be impacting their mental health. So, so depending on where they live, DC's residents feel differing levels of safety in their communities. So residents living in 2, 5, 7, and 8 were significantly less likely to feel safe in their neighborhoods during the day than residents of wards 1, 3, 4, and 6. And then out of all the wards, residents living in Ward 8 felt the least safe in their neighborhoods, followed closely by Ward 7. So they had done a survey looking at how safe people feel during the day and then at night inside their house, outside on the streets, on public transportation, in public places, in parks, and in playgrounds in the neighborhood, and while in a car. So if you notice, Ward 8, whereas in Ward 1, 76% of people feel safe in parks and playgrounds, only 47% of people in Ward 8 felt safe. Similarly, stores and restaurants, Ward 8 was only 50% and Ward 1 was 85%. So this points to the necessity of also making sure that these spaces, there can be grants, there can be projects to create these beautiful pro-social green spaces in a community. But if it isn't paired with some sort of a safety initiative as well, they may go unused or underused simply because people don't feel safe. And then at night, only 15% of people in Ward 8 felt safe in parks and playgrounds. And even inside their house, only 58% felt safe. So, as I mentioned, right, so residents of Ward 7 and 8, they have fewer gaps-friendly design elements. And then also when even for the spaces that do exist, folks are not feeling safe, which may lead them to not use those spaces. Okay. Let's see. I also looked at schools as safe places, youth safety, how safe they felt walking to school, riding on a bus while in school, and at school-related events. Again, with Ward 8, students feeling much less safe than Ward 1. There's research also into people's, like, what kind of commute do you have even when you're walking? But just the idea of being able to walk to school, to walk to work, that can have a profound impact on a person's daily, mental health and stress levels. So, it seemed like whether they were children or adults, there was a definite discrepancy there. Finally, I looked at recreation centers, which were spread pretty evenly throughout the district. The blue represents recreation centers for the District of Columbia. I just touched on, the fact that I was talking about safety from violence, but there's other environmental contaminants that can also endanger mental and physical health. Safe spaces for DC's homeless population. So I was looking at what kind of spaces is the city creating for people experiencing homelessness, and looking at aging as well, how people prefer to age, where they prefer to be, and looking at briefly, again, this is a very broad reaching and not going into depth in any one particular realm, but the idea of not only having walkable mixed use neighborhoods, but also neighborhoods that have different generations of people, living in one area. That can be beneficial as well. And this was talked about in the previous mayor, before Mayor Bowser, their age-friendly DC strategic plan that wanted to be inclusive of all ages. And then finally, I just wanted to touch on some other considerations. So there's lots of other factors outside of the ones that I mentioned. For example, light in buildings. There's been research into how light can play a role in regulating the feel-good hormones, and many other unforeseen factors that may play a role. As I mentioned, it's only as mental health starts to garner more public attention that, especially when it starts to go into urban planning and legislation and decision makers that previously did not have to take mental health into account when making those decisions. They'll only start doing that when there is research to back what we all intuitively know to be true. And I'm gonna pan over this just because I realize that we're not all from DC, we're not all in DC, and this was just one way to look at a city through the lens of mental health. So basically, the paper was looking at the positive mental health benefits of having green, active, pro-social, and safe places within a city. And then a possible correlation between areas of DC with sparse gaps elements and poor mental health outcomes. But by no means was the correlation even fully established. Or rather, you could see a correlation when you overlay the maps, but there are so many factors that a paper such as this can only show the potential for research in all of these different areas. And my hope is that some of you all who are on this call who do research and write the grants and are in academia can maybe think of some new ideas for directions for where this research could go, because mental health and the built environment is a up and coming growing field, and it's going to only become more and more relevant, especially after COVID, when we've realized what kind of a toll not having social interactions can have on mental health and well-being. So I'm going to go ahead and link this paper in the chat. Okay, I see that it's already been linked. And I'd love to open it up to questions, conversation. If other folks have had experience kind of in this realm, if you could add your 2 cents to this conversation.
Let me kick it off with just maybe not so much a question, but an observation. Your paper has a piece of it focusing on perception of safety within the neighborhoods. And, obviously, I think those of us who are familiar with the social determinants of health, clearly recognize that one of the issues there is living in neighborhoods or living in places just generally where the neighborhood is not safe. Your environment is not safe, daytime, nighttime, anything. And it's interesting to see that piece of the SDOH analysis placed into an environmental context. I mean, it clearly draws a relationship between what is an important core element of public health into how the environment plays a key role and obviously a basis of your study. I thought that was pretty interesting.
Yeah, thank you. I think also, and I remember, as I was doing my research, I did come across maybe 1 or 2 studies that that had directly looked at, they had surveyed, the mental health indicators prior to implementing like a new initiative to create walkable mixed use spaces in the neighborhood. And then they had done it afterwards. And that was really and they talked about safety as well, perceptions of safety. And I think actually perceptions of safety got better once they had implemented the mixed use neighborhood, I guess, infrastructure. But I really think that there need to be more of those kind of prior to putting in new infrastructure to poll people, to figure out what's the baseline.
I think so too. What was really surprising to me, and I feel like this is probably one of those areas that you wish you could have dived deeper in, is I feel like gentrification, you mentioned it briefly of how it can impact mental health. And I think that's something that I'm not super familiar with myself. And I think that that's really a good area to see, since it is such a controversial topic, and in ways that, like, yes, is it good, but is it really good? And I think mental health, that key point or how it's affected by that, isn't really explored as much. So I'd like to see hopefully more of that in the future. I don't know if others also had a similar take on that.
Can you guys hear me?
Yeah.
Thank you so much for that talk. It was really, really interesting. I work at the Children's Hospital in DC, and I work in their Health Advocacy Institute. And most of my role is helping to link families with mostly children, so under 18, with mental health resources in the community, and work a little bit with kids that live outside the district, but mostly within the district. And so it is really interesting to see how some of these other social resources type of spaces, it like my experience with the resources available tracks really similarly, where there's just a dearth of resources in certain areas of the city. And I am just kind of curious to see, like, did you disseminate this report out to people? Coming from more of an advocacy lens, I feel like this is, has so many rich points to be used, either like shared with the council or different groups that are in the city.
Yeah, oh, take care, Susan. Thank you for coming. I shared it with the folks that I interviewed to help me with the paper. So the Department of Transportation folks, the people who work in the disability office. And then I kind of completely forgot about it until Tom reached out kind of out of the blue. But yeah, I think I was hesitant to, because I wanted, I don't have a PhD. This was a capstone project for a master's degree. And I wanted there to be more research. It was frustrating to me that there wasn't as much as I felt like there should be before presenting it to, a council. But I think that's a good point, though. In order to get those initiatives and that research, more folks need to know about it.
To Allie's point on gentrification, at least with respect to DC, there is I think, a fairly serious debate going on here about the impact of gentrification on the underserved populations. I mean, DC is a small, very small, they want to be called a state. Some people want to call them a municipality. It is, geographically, it's very small. And when a neighborhood or an area becomes gentrified, the people that are living there are literally moved out, often out of the district. And so their lives are no better. Their lives may be worse. And studies that just look at the statistical aspects of where people are distributed without taking into account those underlying socio-demographic factors can often be misleading. But it is a fairly serious debate here, at least among the urban planning people, about what exactly are the impacts of gentrification? And it's an important issue, and it's something that people need to really pay attention to.
Hi, Hannah. If I can jump in, thanks so much for your presentation. I really appreciated it. I'm based in Toronto, and so we have 140 neighborhoods here, and I really appreciated how it was really interesting to see the 8 different wards and see how like that direct comparison between wards 1 and 4 and 7 and 8. Thought that was really interesting. And I was wondering if you had thought a little bit more about access. And like, I know you mentioned in terms of being able to get to parks and how that sort of probably changes the relationship, but also I'm thinking about how people experience spaces and urban design and how that impacts their mental health. So not just like perception of safety, how it's, changed based on, like, we're seeing heightened anti-Asian racism here in Toronto and how that's impacting folks, but also maybe not even having the time to go to these spaces and use it for their mental health. I was just curious about your thoughts on that.
Yeah, thank you so much for that question. And I think that, that also kind of ties into the gentrification topic, right? That there's data, and then there's research and all of that. And then there's, what that data implies and everything that's omitted based on just how you're choosing to frame something or how you're choosing to look at something. My thinking has definitely evolved in the past 2 years. So I for the past 2 years, I've been doing Teach for America, and I've been teaching in Prince George's County in Maryland. And I think, looking through those lens, it's a lot more clear to me now that is like a huge blind spot of the paper, right? However, if I had included that would have, like doubled the length of the paper, right? I think I'm grateful that at least right now, it seems that access is becoming more center stage in conversations about equity in mental health, in planning, and all sorts of aspects. And I think my goal with the paper when I wrote it was to try to shine some of the spotlight also on just what might be exacerbating what already exists. But I agree. I think were I to rewrite it, it would be a lot more through the lens of, I don't even know how a paper like that would really be written, if I'm being honest. Because there's so much, right? You can go into educational inequity, you can go into income, you can go into, systemic racism, you can go, and it's just like on and on and on, right? And this is just one of those layers of many. I think I could have made that a lot more clear though. Thank you.
No, for sure. And it's not to put you on the spot. I think it's amazing. Thank you so much for sharing. I really also appreciated how you talked about the GAPS framework, and I was just curious about where they came up with it as well. So
yeah,
pointing that out.
Yeah, and I think it is interesting. So with this journal, because that was something that I asked. I was like, what, like, and it's backed here and there, but I think there could be a better framework that's a little bit more solid in terms of research that backs, okay, these things really do matter,
Thanks.
Yeah. If anyone else had input or questions.
I'll go. I really just want to say thank you. I'm sorry I was late. I am on a million Zoom calls. But I'm Jasmine. I am an epidemiologist, but my interest is in public health and mental health. Kind of specifically, I recently moved back home to like the Flint area. So seeing this is like perfect because I've been wondering, like, how do we make our community better without gentrifying ourselves out. You know, and I actually, just in looking at some of the things that you included in your paper, like I started wondering, like, how do we make these things happen without displacing people, especially things like you mentioned, the aging kind of in place or living near your work. And I think about how here in Flint, like the majority of the population now is getting to be seniors, kind of GM retirees for the most part. And then you have this kind of young, urban, suburban kind of group moving into like the downtown area. And then you have a lot of people coming in from the suburbs to work, but not a lot of, I don't know, good paying jobs for like Flint residents. And so I'm wondering, how do these things happen while still being able to keep the community in place, you know?
Yeah. Thank you, Jasmine. That's, I think, yeah, that's a struggle, right? Because you want to point out that, you know, that I think when you make a space nice, more people want to go there, right? And it's about putting in safety measures so that that doesn't happen. And I think, as you mentioned, I think the aging in place component is really important because it allows then folks to kind of start to build that like intergenerational community, and ideally, you know, the building of intergenerational wealth within, you know, the residents who already owned and lived in that area. I'm not going to pretend to know the answer to that, though. I think that's one of many things that I highlight in the paper is just, you know, something that research more. Because I don't know. I don't think a lot of people know.
Fair. And that actually brings me to the last part of my question. Do you know who's doing this research? Because I would love to get to know them.
Yeah. I'll put you in contact. If you put your email in the chat, I'll send you. You know, I'll connect you.
Perfect. Thank you.
Yeah. Thank you. Hi, Earl.
Hello. Thank you for that excellent presentation. And I'm old enough to remember the DC from the 1950s onward. So I'm out in California now. But one of the main things I wanted to say to you is that after spending most of my life not as a professional, now that I am a professional, I no longer have the respect I once did for professionals. And so there's no need whatsoever for you to apologize from my perspective for not having a PhD, because I think the work here that you've done is excellent. And I have found, I'm a minister, and I found my co-religionists very reluctant to go in and accost you because they're so frightened. As I was frightened when I first moved out here, going certain parts of Oakland and Richmond, California, and that sort of thing. But I think the fear, which has really been hyped by the media, does us such a tremendous disservice in trying to work together.
Yeah, thank you. Yeah, I can't imagine having actually lived. I mean, I was reading about the history of DC and the changes that have taken place, but to actually see that is it's powerful.
Yeah, I normally get back like once a year, and every time prior to the lockdown, and every time it seems the traffic has gotten worse. Areas are more crowded, but you know, the church I grew up with at 16th and Harvard, the townhouses across the street from that are now just completely gentrified, beautiful, expensive, but the church itself now has a steel gate around it to protect it, I guess, from things being stolen. So interesting to see the changes over time.
Yeah, and I think your comment about perceived safety preventing people, like it's a whole vicious cycle. You know, there's so much, and I think sometimes there's a tipping point, right, where if you can get all of those things in alignment, you can get people to feel safe and go out and use the spaces and then actually be safe. And, you know, I don't know what it takes to kind of push the wheel so that it starts to spin in the right direction. I appreciate your comments.
Certainly. Thank you.
I would just like to just comment back to Jasmine. I mean, this is only my perspective, but one of the things public health professionals can do and add value that they don't do often enough is to engage in advocacy. People want to tend to, you know, maybe look at research, maybe look at, you know, practice, but in and of itself, being able to advocate locally within the community for good public health measures is something I think is we all can do a better job at. And obviously people are aware of what's been happening in Flint over the last couple of years and the need for very good public health measures to be implemented up there for any number of reasons immediately. Clearly the public health advocates should have a voice in anything that's happening up there. And I think we can all do a better job of that.
Yeah. Well,
And
oh, go ahead.
well, I was just going to say we're coming up to the top of the hour, and I don't know if you have any closing remarks you want to make before we let people go their way, Hannah.
Yeah, I just, you know, wanted to thank you all for coming. If any of you is interested in either, you know, getting connected with the folks from the journal or, you know, would like to talk about this more, you're welcome to put your information in the chat. Yeah, I hope that, you know, this has maybe provided a couple of ideas for maybe newfound passions or interests or areas of inquiry. But yeah, thank you all so much for coming, and wish you all the best.
No, thank you for this. It's a great presentation. Appreciate your efforts and thanks for sharing.
All right, take care, everyone.
Thank you.
Thank
Have a
you.
great day, guys. Be safe.
Bye.